Laser resurfacing and TCA. TCA stands for trichloroacetic acids. It's a type of chemical peel. Chemical peel is a generic name. It could be anything that the estheticians, they probably have 25 or 30 peels they do, but none of them are as strong as this TCA peel or something, another one I do called a croton oil peel. Those are specific peels, but chemical peel is just generic. And all chemical peels are doing is removing the outer layer of epidermis and then some of the dermis. You know, the dermis makes the epidermis. That's where it grows. So if you got wrinkles or brown spots in your skin, we try to burn off, which is really what we're doing, but they don't call it a chemical burn because who's going to do a chemical burn? They might sign up for a chemical peel, but not a chemical burn. So we're going to remove that outer epidermis and dermis and get down below those wrinkles, remove them, and then the dermis makes new collagen, elastic fibers, and the skin cells to repopulate the surface. And that's a thicker skin. It's a healthier skin because it's got more water content. For that reconstruction project, it's got more protein in it because it's brand new. It's new construction. So let's look at some of those, if I can get it to go. This is the only slide in here that's not mine. I don't have a patient yet who came in with that amount of quality problems and quantity problems. You can think of it, quantity problem is like a pair of slacks. You've lost 20 pounds, they don't fit anymore. You got too much quantity of fabric. You take them to the tailor, they snug them up, they fit nice. That's like a facelift. But if they got mustard stains on them, they still don't look good. So you got to take them to the dry cleaner to get it completely where it's rejuvenated and looking good. The dry cleaner in this instance is the chemical peel. We really don't do so much laser resurfacing anymore. Why? Because it's a $100,000 machine and you've got to pay for me buying a $100,000 machine. Whereas chemical peels are pennies for the chemicals, so it's much less expensive and it does the same thing. So quality and quantity problems. Here she is afterwards, smooth, tight skin. If she'd just done the chemical peel, she'd have smooth, loose skin. If she'd just done facelift, she'd have wrinkled, tight skin. Here's a lady who had eyelids done, brow lift, and a chemical peel. Smooth, fresh, normal looking. You can still see she's sort of pink underneath her skin. And that pinkness is a good sign. It means she's still making collagen and elastic fiber. She's tightening her skin for months afterwards.
Did she have a facelift?
No, she did not.
You don't see much of her labial fold there.
You don't, and because the tightening effect of that chemical peel. Chemical peel will give you about 15% of the tightening that a facelift will.
Would you recommend chemical peel on us older ladies whose skin is thinning out to begin with?
If you have wrinkles, yes. If you have brown spots, yes. If your skin is good but thin, I don't think you see the benefit. I don't think the risk-benefit ratio is as good. I would choose other things. Gentler peels, Rejuvepen, things like that. So the risk-benefit ratio has got to be right. Here's a lady who had a brow lift. She had her eyelids done. She had a facelift, and then she had chemical peel because she had quality and quantity problems. And you know, she's 69 years old, and you don't have any problem believing that, but she's now 70. That's a little harder to believe. And it's all, looks normal, looks like her. Same thing here. Look at the lines around her mouth, the lines on her cheeks, lines on her eyes, all much better with a chemical peel. Lines around her eyes, gone. Lines around her mouth, smoothed out. We've probably done 2 or 3 chemical peels on her. And she's 75. She is 75. She's got good skin to begin with, and she's worked at it a little bit. But she's one of the nurses in town. Botox fillers, we've heard a little bit about that. Light therapy is the IPL. It's not a laser. It's intense pulsed light, IPL. And I'll show you a couple pictures of that. So Botox, there's me with wrinkles. I bet I don't have that many wrinkles tonight. But look at it, it was in 2000. So 15 years later with Botox, I don't have as many wrinkles as I did then. Botox is awesome. It works great. Its only problem is it doesn't last more than about 3 or 4 months. Mine lasts a long time because I've been doing it for 15 years and my muscles are weaker because they never get exercised. So mine probably lasts 6 or 8 months, but I've been doing it for 15 years. It's just as safe as taking 2 aspirin. If you take 25 units of Botox, you're fine. If you take 2 aspirin, you're fine. If you take 2,500 units of Botox, one, you're going to be broke, and then you're going to be dead, because that would be a toxic dose. But if you take 200 aspirin, you're also going to be dead. So it's equally as safe as aspirin. It works wonderfully. It works on the crow's feet. It works on the forehead lines. It works on these glabellar lines. There's some other uses down in the neck. It's just good stuff. We like Botox because we have a good relationship with that company. Dysport's okay. Xeomin, and they're all chasing Botox, and they're all pretty good. And it's Kleenex versus Charmin. I don't know. Frowning, still frowning, but no wrinkles. Same thing. Fillers, we use hyaluronic acid. It's the Restylane and Juvederm primarily for us. Works great. It's your own, it's human hyaluronic acid that's made by bacteria. The hyaluronic acids are like the air in our environment for inside the body. It's everywhere. It's inside the cells. It's outside the cells. It also works wonderfully. It lasts for a year, and the new one called Voluma lasts for 2 years. You don't have to harvest fat. It's very reliable, and if you don't like it, you can put an enzyme in and dissolve it. So let's look at a couple of those. Lip enhancement. Isn't that cute, though? We're going to talk about lips. Okay, let's talk about lips. Now, I'm also not the lip police. So some of these lips are bigger than I like, but this is what they like. So I think that looks very nice. And you can just inject right here, and that filler will go right along that line. For other patients that have radial lip lines, you can dilute it and have it fill up that radial lip line. And that's a good answer for some people. For other people, fat grafting is a good answer. For other people, chemical peels or lasers are a good answer. But this is just talking about filling up the lips. Pretty good, pretty full, still okay. I'm a little big on that one, but that's what you like. Bigger here, and you see this asymmetry here, we had a hard time correcting. I still think I can see it. So once something's asymmetrical, it's really hard to get it back to perfect symmetry. Here's a lady with Juvederm getting put in here. You can see some of the marks immediately afterwards. And here she is once it's all healed. You fill up this little triangle right there. This area right here would be a great candidate for Voluma. When you smile and your cheeks are here and you smile and they come up out here, they ought to be up here anyway. So you fill this area up with Voluma. It takes 10 minutes. Virtually no more painful than Botox. Really is a nice result. And it'll help flatten this because it recruits skin from here. As this fills up, it has to pull some skin from there, so it actually makes these folds get better. It's an adjunct treatment for facelift. It's not as good as a facelift, but it fills volume in where volume is lost. Again, making the right diagnosis. IPL, we're going to show you some of these things. So look at this dyschromia. Freckles from the sun. You hit that one time with this IPL and you can get that kind of result. And you can see right there some of that has not flaked off yet. It sort of turns into cookie crumbs and flakes off just like a sunburn does. But really effective and very good for the décolleté area right here. The problem with that is if you got that there, you also got it on your arms and you get rid of it here. You frequently see somebody here and then a month later they're doing their arms and you get addicted to getting rid of all that stuff. But don't get back out in the sun because those freckles will come right back. If you don't out in the sun, they're gone for good. Vascular lesions, red spots. This is some rosacea. And you can see it doesn't stop the rosacea, it just stops the manifestation of it. Some red lines here, all cleared up. Look at the red lines here. And with the lights off, you can see them a little bit better, but I think you can tell they're much better. These are very difficult to remove, but that just in 5 minutes, you can do all that. And it's just a zap, 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 go home. Photo aging, I don't think works all that good. The company thinks it works all right. I think this is mostly a light trick. Why do I keep the slide in here? To tell you that there's a lot of hucksters out there and be careful. Again, freckles that are gone. I don't know how this picture of my back got in here. But that's laser resurfacing. not laser hair removal. You got to do it about 7 times. I think it works really nice for bikini lines and chins and things like that. To do your whole back like that would be unbelievably hard to tolerate.